Hello, my name is Dr. Brett Cascio. I'm an orthopedic surgeon in private practice, and I have been using PRP for approximately 10 years, and I have switched to Transcend approximately 6 months ago, and I've been very happy with the product, and my patients have been very happy with their results, and my staff has been very happy with using the equipment. On PRP at a higher level in my clinic was to satisfy patient demand. This is a patient-driven treatment. Patients were coming in, talking about regenerative medicine, asking questions about regenerative medicine. Many had actually gone and had regenerative medicine either in town or traveled to have it in other locales, bigger cities, Miami, Houston. They were being charged a lot of money. I felt like the patients weren't getting a good value. They weren't seeing orthopedic surgeons. And I felt like with my patients, if they had questions about this, and if they were going to go have this done anyway, and it was a safe and effective procedure, that I would rather be the one performing this for my patients. And so that's how we started performing PRP in the office. We found it to be effective. We found it to have high patient satisfaction. And that is why it grew in my practice and expanded. And now I have patients coming to the office for PRP, and in some cases it is appropriate, and in some cases it is not, and we direct them to another treatment. Non-surgical PRP has affected my practice very positively. It has increased the number of patients that are coming to my practice. It has added to my surgery volume, and it has also increased overall patient satisfaction. It's a great way to develop relationships with patients. You can develop trust with patients because they come and see an orthopedic surgeon and they're not being offered surgery. And so then the patient realizes that you, as in myself, the provider, is looking out for their best interests. We're trying to use a value approach to a treatment option for them. We're catering treatment for the patient, and not every patient is a surgical candidate. The word spreads. Patients then come to see us because they've been offered surgery elsewhere, and surgery just won't fit in their life right now. In general, we're seeing a decrease in some of the elective surgeries because the out-of-pocket deductibles are so high. Some patients, especially toward the end of the year, have not met their deductible. Sometimes that's a $10,000 deductible. So they're not going to have surgery in November if they haven't met their deductible yet. They're going to, if they have to have surgery, they're going to wait till January where they can meet their deductible, and then it'll be met for the rest of the year. So that's just one example of a situation where a patient would choose PRP rather than surgery. Of course, if surgery is indicated and PRP is not, we're not going to offer them PRP. But in general, PRP has become an offering to patients along with a steroid shot. We talk to them about all their different options. Basically now we say patients, you can have two different types of shots. You can have a steroid shot, or you can have a PRP shot, physical therapy or chiropractic therapy, and then surgical options. So it's now part of our discussion with patients, and some patients come in that are looking for PRP. Some people are surgical candidates and choose instead to have PRP. But overall, it has grown my practice, and patients that are looking for treatment and looking for a good doctor that's going to give them all their options and give them value for their healthcare dollar are coming in the office. And some of these patients just need surgery. PRP is not an option for them. And in that way, it has grown my surgical volume. Insurances do not, in general, cover PRP. This is a upfront discussion we have with patients. Patients appreciate the candor and honesty, and they don't want to not be offered all the options, and they want to be offered every option that we think is appropriate, and then let them choose. And patients, more often than not, are fine with paying for PRP because quite simply, their insurances are such high deductible insurances now that even if they're paying cash for PRP that has over 50% chance of working, that's still a better value for that patient because they are not missing work. And basically in about 6 weeks, they know whether it worked or not. And then they can consider surgery later if the PRP doesn't work. That they think it's a good value, and it is a good value. And their deductible's so high anyway that sometimes the $10,000 deductibles makes the surgery not even an option for them. So really, this is a question of insurance is not covering this option, but it will cover a steroid shot. So many times we'll just start with a steroid shot. A lot of patients, though, have diabetes or they've had multiple steroid shots, so that's not an option for them either. Then physical therapy is another option. That's not cheap. You know, every visit can cost the patient $50 to $100. They get 6 weeks of that. The price tag on that goes up. And if they have a full thickness rotator cuff tear, that's probably not going to work either. Even a high grade partial rotator cuff tear, that's not going to work. So the patients are shouldering more the burden of their healthcare costs, even though they're paying insurance premiums. And so they are looking for something that makes sense for their life. And a lot of patients are very active. They don't want to take off 3, 4, 5 months from work while they have a huge bill for a surgery and physical therapy. This becomes, at this price point that we quote our patients, becomes a very attractive option. And we know that because so many patients are choosing it. I've been performing PRP for my patients in my office for approximately 10 years, and I've switched to Transcend because of the simplicity of the equipment, the high purity of the PRP, the low white blood cells in the product, and the satisfaction of the patients that are having the procedure, the lower pain that they have over the first few days after the procedure, and overall the satisfaction the patients are having. Well over 50% of my patients are happy with the procedure, think it's cost effective, and that it helped them, and they would refer the product to other friends and family, and they would have it done again, and many have had it done again on different body parts. Transcend is a very responsive company. They believe in education. The first process, or the first beginning of the process, was to educate my staff, educate myself. I've been doing PRP for 10 years, and I still learn things in the beginning of their educational process. So I immediately felt comfortable with the process, and there's local support for the equipment and the process, and we felt very comfortable with the team right off the bat, and we have not had any issues since we started.